Okay, good afternoon, everybody. Today we are continuing our product topic, the use of basic and target 零值. I think we some whole company have putting more focus for us to use target 零值, as target 零值 has more research based and more efficacy, and we even have a lot of patents on the certain 零值 and the health function, for example, the kidney and also the cancer disease. And we still have our traditional basic 零值, which is our 永健零值, Shuang Hor LingZhi. So today's topic will be focused on how to use of the basic 零值 and the target 零值 together for various type of health condition. I understand that some leaders might have a confusion since we launched the target 零值, they don't know what to offer to the customer. And especially we have mixture of the basic and the target 零值. So today's topic basically to tell everybody, provide you a guideline on how you propose a dosage to various health conditions like for health maintenance purpose, pre-illness purpose, or even illness conditions. Okay, so let us start. Before I start, let me go through a disclaimer. All the information contained in the slide are intended for general health information and educational purposes only, and are not intended to be used as a substitute for a professional medical advice, treatment, or care. Okay, let's start with our base 零值. As I mentioned, our base 零值 consists of Yonggen Gardodema. As now we have more target 零值. So before I talk about target 零值, so I'll talk about Yonggen Gardodema. So for Yonggen Gardodema, we are actually having this 2000 awarded Taiwan first immune regulation health food accreditation, followed by 2001 we awarded the Taiwan very first liver protection under the health food accreditation. So for immune regulation, I think a lot of people have seen this. We have awarded with 5 functions: promote the production of antibody, production of immune cell, regulate the function of T cell, promote vitality of natural killer cell, and promote vitality of phagocyte. Under liver protection, help reduce the indices of GOT and GPT, help increase the protein content of the liver. So Yonggen Gardodema, I always summarize into 4 functions. Number 1, regulate immune system. The immune system is too low, you get sick easily. Your immune system is too high, you might have allergy condition, even autoimmune. I think that's how we mentioned about by Jim. We have this thyroid disorder. Graves' disease is usually autoimmune disease. Yonggen Gardodema also very good for liver, enhanced liver function, liver protection, and it's good for improved blood circulation and remove free radical and antioxidation. I think this one we are very familiar with it. So for health maintenance, we will talk about 4 to 8 capsules daily, depending on body weight. People have pre-illness, for example, 3 high, it's good to take about 12 capsules daily. For illnesses, for example, people already give a name. For example, kidney deficiency, kidney disease, or anything. Last time we normally propose to take about more than 20 capsules daily. Or for cancer patients, we are proposing to take about 30 to 60 capsules a day, even 120. But with the current target 零值, now we're doing to use this Yonggen Gardodema. But Yonggen Gardodema is still used as a base for many people to consume. So it's still good. Base means that it can consume by everybody. Okay. So now I move on to even target 零值 Yonggen I. Yonggen I Gardodema, today I only want to do a summary, but we have covered this in many sessions in detail on specific equivalent target 零值. Yonggen I Gardodema, I think we know that it's actually for immunomonitory, for example, antivirus and anti-allergy. And now, like for example, now there's a flu season going on, so I'm actually very encouraging all my customers to take Yonggen I. Yonggen I is actually a base. The base is actually Yonggen Gardodema, so you have a very good liver protection property. And because of the added beta-glucan 1,3 and 1,6. It has very good property on anti-diabetic. So I think this one we know about it. So for health maintenance purpose, or we relieving slightly illness, we take about 2 to 3 sachets daily before meal. And for example, for certain emergency situation, but for example, when you get COVID-19 virus, we get a very serious flu virus, or you're attacked by virus or any kind of virus, you can take 1 sachet every 2 to 4 hours, even taking to 6 or 8 sachets a day. So this for Yongken I. Okay, we move on to Yongken B. I think Yongken B stands for bone. So Yongken B have a high concentration of 1,3,1,6 beta-glucan, which is belong to the macromolecular polysaccharide group. And actually it's a stem cell, I will call it as it's the stem cell ganoderma. Stem cell, you know what's the meaning of stem cell, right? Stem cell is the one we convert to any our body cell. It's just like when playing cards, there's a card called Joker. This Joker actually can substitute any card you like. So this stem cell got 2 types of stem cell. One is a hematopoietic stem cell. One is called the mesenchymal stem cell, which is called peripheral stem cell. So the bone marrow stem cell, we call it, actually can build your blood cell, for example, red blood cell, white blood cell, and the platelet, because bone marrow is the one who produce all the blood components. So this product is very good to target for people going through chemotherapy, any targeted therapy, and other medical use that actually suppress the bone marrow from producing all the blood components, white blood cell, red blood cell, and platelet. And this product also have the mesenchymal stem cells, which is actually very good for grow, repair, or regrow your other part of body organ. So you're repairing damaged tissue, organ, and severe infection that caused by severe infection or aging. For example, when people are taking antibiotic, going through trauma or surgery, going through radiation therapy, or sometimes even some so-called accident injury. So this is also a very good product. So recommended dose is about 1 to 2 sachets daily. And for emergency situation, you can take out 4 to 6 sachets daily. For example, people having trauma accident, or they're having, for example, a massive virus or bacterial attack in the body. So you want to quickly build the immune system back. Then you can give more of this Yongken B. Okay, we move on to Yongken K and S. Yongken K and S, I think we know is for our kidney protection and kidney repair. If you're wondering what's the two difference between this product, 1 sachet of Yongken K is equal to 6 tablets of Yongken S. I repeat, 1 sachet of Yongken K is equal to 6 tablets of Yongken S. So kidney is our detox organ in the body. It actually filter all the waste from the blood into urine, and then after that release to bladder and our urinary tract system. So it's good to, if your body have a strong kidney, you can better effectively remove waste, remove toxin. And some people have this toxin because of medication. You need to release from the kidney, and this is a good product to follow. Kidney disease, when people are having kidney deficiency, this is a product to take. According to Dr. Chen Hai, if the kidney function, we call EGFR is less than 50. Okay, normal people EGFR have to be more than 90%. And when the EGFR is less than 50, and if it goes to 15 to 30, you might need to go for kidney dialysis. When kidney EGFR less than 50, you can take Yongken K. But it's between 50 and 90, you can still take Yongken S. So Yongken K definitely is a more concentrated product for this kidney protection. And you also protect heart, liver, and lung and brain. Okay, and for people who have serious allergy problem, autoimmune diseases, this is also a product to offer. So to stay healthy, 1 to 2 tablets of Yongken S per day. For example, you want to do a cleansing on your kidney. For this minor physical issue, you can take out to 4 to 6 tablets of Yongken S People who go for dialysis, you can, or I have mentioned, already close to dialysis situation, you can take 2 sachets of Yongken K or 12 tablets of Yongken S. And all this effectiveness I mentioned about is actually proven by animal experiment in our lab certified by GLP, which stands for Good Lab Practices. Any product that need to send for example, American FDA approval, you definitely have to go through an animal study first. An animal study must do in the lab that have this so-called GLP accreditation. And I mentioned just now, our product got many patents in the world. Like for example, our Yongken K and Yongken S have a patent on kidney function improvement, and we got patent from China, Taiwan, EU, USA, Hong Kong, and Singapore. And this is very encouraging. Okay, let me move on to Yongken C Gaudoderma. This is the most valuable product in our equivalent target LingZhi range, which is for cancer. So it has high concentration and high purity of galidaric acid TS and dosideric galidaric acid S, and it's very good to fight cancer cell. Okay, and this product actually able to pass through our BBB, brain-blood barrier. This BBB is a filter that actually preventing all the bacteria viruses to go up to the brain, because brain is a very crucial organ in our body, because it's a central nervous system. And so because it can pass through BBB, so it can help to support sleep, stabilize our nervous, and also brain related function. So this one is actually can provide aid to our neurological function. So, and for cancer, for people who suffer from cancer, so we can propose to take 4 tablets per day. People with trouble of sleeping can take 1 or 2 tablets per day. And people who have actually, for example, Alzheimer's and all these kind of diseases, okay, dementia disease and all this, so this one can actually also take this product 1 to 2 tablets a day. Yongken C also have patent. It's a patent on therapeutic composition for treating cancer. And as I mentioned, we are the number 1. We obtained patent from numerous countries: US, Taiwan, Singapore, China, Hong Kong, and even Macau. So basically, we're talking about worldwide patent. So this one is very, I would say, is very encouraging. We are the number 1 in the world to able to secure the patent using gaudoderma for cancer treatment, which is not easy. So how to choose appropriately? Our basic LingZhi, Yongken 1. So Yongken 1 you choose is for maintenance health. Okay, so you still can use to achieve certain therapeutic effect, but you need to take high dose. But now with the equivalent target LingZhi, you are aiming at specific disease to combat them effectively. So actually you can take fewer dose to achieve desired effect in a shorter time span. So this one is actually the way you use basic LingZhi and equivalent target LingZhi. Okay, so I repeat, basic LingZhi for health maintenance. To elevate symptoms of illness, you can slowly move on to equivalent target LingZhi. You aim at specific disease to combat them, for example, kidney problem and cancer, you can straight away use equivalent target LingZhi. Okay, let me share with you some guidelines we use. For example, for health maintenance purpose, this is just a guideline, okay? So anyway, LingZhi have the no limitation on dose, because we do have side effect when we're taking even a higher dose. So it's very safe to recommend any dose to people. So for health maintenance, so maintain of the body physical function, you can use Yongken Gaudoderma 4 to 6 caps daily. We will talk about this, just the health maintenance 4 to 6, okay? People say, can we use Yongken I instead of Yongken LingZhi? Yes, you can use 1 to 3 sachets daily, especially if the family member having history of high blood glucose or diabetic. You know that Yongken I product, besides designed for antivirus and bacteria, you also designed for combat high blood sugar or diabetic. So people who have just had high blood sugar or diabetic, he can take just Yongken I. Okay, so for health maintenance purpose, you can take 4 to 8 capsules daily for Yongken LingZhi, Yongken Gaudoderma, or you can take 1 to 3 sachets of Yongken I. So for high people who suffer more, who history, the family history, he might don't have yet, but he had family suffer from high blood sugar or diabetic. You know that if both parents having diabetic, the chance of the next generation having diabetes is 50%. Okay, for people who need intense health maintenance, for example, when you're already more than age of 40 years old, you need to have more repair and maintain body physical function. So you can take Yongjian LingZhi or Yongjian I, but you can plus Yongjian B Gaudoderma. Remember, Yongjian B is actually a stem cell product for bone marrow stem cell and your other uh, body organ stem cell. So you can take together. This one is to maintain body physical function. You can still take 4 to 8 daily of your Yongjian LingZhi or 1 to 3 sachet of Yongjian I, but you can added another 1 to 2 sachet of Yongjian B to help to repair the organ. So you can see the base is still your Yongjian Gaudoderma and Yongjian I, but you plus the Yongjian B 1 to 2 sachet a day, especially people who need to do repair and more maintenance of body function, especially they are more than age of 40, where the organs slowly already in the degenerative stage. However, when people who suffer from certain autoimmune disease or they need more repairing, they can do Yongjian or Yongjian I plus Yongjian B plus Yongjian S Gaudoderma. Okay, so it's the same formula, but you can add on another 1 to 4 tablet of Yongjian S. It means that after age of 40, if you do a EGFR test on your kidney, you know that it's still about, maybe it's already less than 90 already, or range of 87 to 90. Maybe it's good that you add on a Yongjian S 1 to 4 tablet a day. Or the person having some autoimmune diseases, as mentioned by Jim, for example, the grave diseases that will affect thyroid, he can add on Yongjian S. So I repeat, your intense health maintenance, beside the Yongjian Gaudoderma, Yongjian I Gaudoderma, you can plus Yongjian B. People who want to have more kidney protection and also maybe have autoimmune disease, you can add on Yongjian S. So this for health maintenance. Okay. How about pre-illness stage? For example, people who have 3 high. Okay. We always say, if we last time we already talked about, if you are using Yongjian Gaudoderma, you can take about 12 cap daily and above. However, you want to use Yongjian I, that's also possible. Then you must use 4 sachets of Yongjian I daily and above. This is particularly important if the person having a diabetic or the family member having diabetic. Okay, 3 high, that is diabetic, so we can use this. And because for example, 3 high, the kidney already suffer the deficiency already, or because the long-term use of 3 high medicine, which might be burden the kidney and liver, so it might add on another 4 to 6 tablet of Yongjian S or another 1 sachet of Yongjian K. I repeat, for pre-illness at 3 high stage, you can use Yongjian Gaudoderma, you can use Yongjian I if the person having diabetic. You can add on Yongjian K or Yongjian S if the person actually have long-term use of vitamin medication or there's a kidney deficiency. Pre-illness also apply to some autoimmune diseases. Okay, then you can use Yongjian B 1 to 2 sachet daily. And if the autoimmune disease is more serious, so called severe autoimmune disease, and there's a kidney damage, we strongly recommend to add on 4 to 6 tablets of Yongjian S and another 1 sachet of Yongjian K daily. So for autoimmune disease, you will give Yongjian B, but if it's too severe autoimmune disease and also affect kidney, we recommend to add on Yongjian S and Yongjian K. Okay, how about illness stage? For example, kidney dialysis. People already start kidney dialysis or the EGFR rate at the range of 15 to 30. You need to go for kidney dialysis very soon. Then in this case, we recommend 12 tablets of Yongjian S or 2 sachets of Yongjian K. So this is for kidney. The problem of people going through kidney dialysis. When people go through kidney dialysis, does it need to take Yongjian K? The answer is yes, because they actually help further to stabilize the body, especially when you go through kidney dialysis. However, you want it to recover from your kidney from dialysis. If the person just started dialysis for 3 months and 6 months, maybe still possible, there's a chance. But if the person dialysis for more than a year or 2 years, the kidney already shrink, they might have no chance to recover the kidney function. Cancer, we strongly recommend Yonkin B to start with, 2 to 4 sachets daily to wake up immune system, to better detect, to let immune system detect which one is the cancer cell. So Yonkin B actually recommended 2 to 4 sachets daily, plus Yonkin C Gallaudet tablets, 4 tablets daily, especially if the 3 and 4, stage 4. Stage 1 and 2, you still can consider take about 2 sachets of Yonkin C. However, if the kidney function already affected, partly because of the treatment or the cancer drug, we recommend another 4 to 6 tablets of Yonkin S daily, plus another Yonkin, 1 sachet of Yonkin K. So for illness stage, if it's kidney, add on Yonkin K and Yonkin S. For cancer, we use Yonkin B plus Yonkin C, and the kidney affected, we to put on Yonkin K and Yonkin S. So conclusion, the principle of taking LingZhi to achieve optimal benefit, you take in a fixed time, fixed dose, duration, daily, and minimum you take a duration of 4 to 6 months, because your bone marrow will need about, for example, 4 months to build a new batch of red blood cell, for example. So you generally need to take consistently every day at a fixed time and fixed dose. So this for a person to achieve optimal result from taking LingZhi. Okay, and that's all for my presentation. Thank you.